We've talked about that in extent on the show before, but we're going to talk more about that and talk to Susie in just a second. But Esther on line 2, thank you so much for waiting. Your question for Dr. Parent.
Yeah, my question is, my son Andre is an organic farmer, and he was educated and also as a farmer in Arizona and also Hawaii, where he graduated with his master's in aquaculture and agriculture. Point is, he lives now in New Mexico, where he's a farmer, and he has cataracts. Question is it because maybe he didn't wear a hat or sunglasses that was formulated at a young age?
Esther, sounds like your son's a sun man. And yes, there is an increased risk of developing a cataract, particularly a nuclear sclerotic cataract, when you're in the sun a lot. We advise all our patients that wearing inexpensive sunglasses, you don't have to buy real expensive sunglasses to have them protect your eye, and to wear sunglasses is a good idea. So I would tell you that there is a chance, certainly, that was a factor in your son's cataracts. But one thing you need to know is that usually when people have cataract surgery, most of the time it's successful. It'd be nice if he selects his surgeon and makes sure they've done a few cataracts. And then he needs to talk about the options. And there's no pressure to have cataract surgery just because you have a cataract. The reason you have cataract surgery is because you can't see to do what you want to do or like to do, or you would like to see better.
Mm-hmm. All right, well, we have another caller on line 1 is Sandra. And Sandra, we're going to get to you in just a moment, but we want to talk to Susie, who is one of your patients, Dr. Parent. And Susie Powley, originally from Huntington, actually lives there, came in to see you, Dr. Parent, for help because you had some interesting vision problems. And he mentioned Coke bottle glasses earlier. And before the show, you told me that you used to wear those.
Oh, yes. I was got them probably second grade, and didn't realize that bricks went all the way to the top of buildings, and there were actually individual leaves on the trees. I knew they fell, but they...
Wow.
Yeah, it was
Well, no
something.
wonder you're beaming.
Yeah.
Your smile is beaming. You actually have had trouble pretty much all your life. And
Oh, yes.
The cataracts. Have you had cataracts all your life?
No. In fact, I had gone to the eye doctor about 2 years ago, and decided that I needed to have some new lenses because I just wasn't seeing well.
Mm-hmm.
And they were able to get my vision corrected in my right eye, but not in my left eye. And no matter what they did. And so they looked a little deeper, and sure enough, I had a cataract.
Mm-hmm.
And I'm not quite that old, I don't think. And they said, oh, that's not unusual at all to get them at a younger age. I always
Right.
thought it was an old person.
True. Well, the left eye, I guess, your left eye has already been done.
Yes.
That was what, back in May 24th of this year?
Correct.
So a few weeks later, how are things going?
A few weeks,
Mm-hmm.
I walked out of the operating room and could see the clock on the other side of the room.
So almost an instant.
Absolutely. And I was one of those that if my glasses fell off the table at night, I had to have someone else find them for me because I
Wow.
couldn't. I needed glasses to find my glasses. And yeah, I was sitting in my kitchen and I could see 4 houses over, and I saw all the siding. It was amazing.
So no pun intended, but this has really opened your eyes to things that you
Absolutely.
just haven't seen in a while. Now, your right eye still needs to be done. Do you have cataracts in that?
I have one that started,
Uh-huh.
and there's also some other abnormalities in there. But yeah, it's and I'm very lopsided because of the difference
Mm-hmm.
from what has been repaired and what still needs to be repaired.
I'm sure Dr. Parent will get you balanced
Absolutely.
out there. And when is your next surgery planned?
A week from Thursday.
All right, and you told me before the show too, because I was hoping that you keep that enthusiasm, but you can't wait.
I can't. I really can't. And you know, it's something that I never thought I would be able to have because I figured that a lens implant is something that only rich people do, and I didn't realize that. I thought a cataract removal was just something they scraped it out and it was done. But this was just a godsend.
That's just great news, and I'm so glad that that worked out so well for you.
Thank you.
We'll get some more information from you in just a second. But Dr. Parent, the difference between the surgery of yesterday and the surgery of today of cataract surgery, how does that differ?
Well, it's very much like arthroscopic surgery. cataract surgery was the first small incision surgery. And an individual named Charlie Kellman, who was a famous individual from New York, invented small incision cataract surgery. He was an excellent individual, bright guy, worked hard at it. And what it did is it took surgery for cataracts and took it from like opening half of the eye to opening that small 3-millimeter incision. And then Mike McFarland, another individual who's a bright guy, figured out that if we make the incision just perfectly, we don't even need to put any sutures in. The eye will seal on its own, so therefore people don't have scratchiness. They have a little bit, but within a day or so they say, I'm just seeing a whole lot better. They don't have distortion, a lot of astigmatism. So it's a great thing, and actually most of our surgeries we do just under drops, topical drops. People get up, they walk off the table, and just exactly like she just talked about, they get up and say, you know, I can see.
Yeah, and my poor grandmother, who was blind in the mid-70s because of cataracts, she did not want to go through the surgery because it was such an ordeal. But it's just so nice to know that it's not such an ordeal. In fact, it's a piece of cake compared to what it used to be.
Absolutely.
All right, we're going to switch gears for just a couple of seconds. We'll get back to you, Susie. But Sandra has been so patient on line 1 with questions, and we have a couple more after that, so go ahead, Sandra.
Yes, can you tell me, with having white circles in my eye, and I have a dark circle around them, and also the other night I just had, they were like speckled spots occasionally, and I have went to you.
Okay, Sandra. The thing I'd tell you is, how long does this last? Can you tell me? Is it seconds or is it minutes?
It doesn't last that long.
So would you say,
Right,
5 seconds, or would you say?
Probably about that.
Well, if it's seconds, sometimes that image that you're talking about, where it actually you feel like there's bright flashes around, or the thing that you talked about at the last, that can be due to traction on your retina. And that could be a problem, particularly if you have some floaters combined with that. So sometimes there's traction on your retina. The dark halo that you're talking about can be an asymptomatic or atypical migraine, or an atypical migraine headache. Some people get that vision before they get their headache, but usually people we see just have the migraine where they see this image. It sticks around usually for minutes, and then it goes away. But I would tell you, if you're having flashing and if you're having some concerns, that you may want to be seen by your doctor and have them take a look just to make sure everything's all right. Ordinarily, the things you're talking about are pretty benign, but you can never say 100% of the time unless you get evaluated and make certain somebody's looking at that.
Sandra, thank you so much for calling. Let's go to line 2 with Sheila now. Hi, Sheila. Your question for Dr. Parent?
Yes, my daughter had laser surgery about 8 years ago, and now she had a heavy prescription, so she got the laser. And now they are telling her that you have to have a wave front, and wave front is not FDA approved in U.S., but they're telling her to go to Canada and get this done.
Well, wavefront means we do a similar laser, not wavefront, but it means that you have custom laser done. And this custom laser, it must be that she was real nearsighted. She had LASIK done. And when you have LASIK done, sometimes with time, your eye will change and you need a little extra treatment to see at the distance. First of all, she shouldn't feel pressed into anything. Again, she can always get in a second opinion. She doesn't necessarily have to go to Canada. But the reality is, wavefront is approved in Canada, and it's done by some people here in the U.S. too. So if she's having a problem and she's concerned about it, first of all, I'd get a second opinion. But second of all, that sounds like a logical option depending on her age. If she's over 40 years of age, she may want to consider some different options, such as refractive lens exchange or something like that. But certainly a touch-up laser is not uncommon for LASIK.
All right. Thank you very much, Sheila. We have Amos and Sarah on hold, and we'll get to you. And if we don't get to you during the show, we'll definitely address your questions after the show. But I wanted to talk to Susie once again about her cataract surgery. What kind of, I told you about my grandmother and her experience, or lack of experience of having cataract surgery because it was just such a major ordeal. What kind of an experience can you sum up that you've had with this cataract surgery in the 21st century?
Actually, I was pretty scared to have it done because I knew I was going to have the lens implant, and I was always able to see up close. And I thought with a lens implant that I might only be able to see far away and not be able to see up close. And it far exceeded my expectations. I'm can see the computer. I will probably be able to see to drive quite well once the other eye is done.
And you were awake for the most part during the surgery.
Oh, absolutely.
So how did that go? I mean,
it was a little weird.
I bet. And it lasted what, about, you said a half hour, 45 minutes?
About a half an hour.
Yeah.
And actually, he had finished everything, and then I remember you asking me if I'd had an eye injury or if I'd been hit in the eye, and I didn't remember that, and he'd found some other little problem, and he fixed it, and I was done.
Wow. And would you recommend it to anybody?
Oh my gosh, yes, absolutely. I would. The best thing is I don't think I'm going to have to wear glasses.
That's excellent.
I can wear sunglasses.
Sum it up, Dr. Parent.
Well, there's no 100% in life in surgery, but the success rate with surgery today is very, very good. And it's people that are cooperative. They can have it done like she does. They usually get up and walk off the table and just walk away, and the next day they're usually seeing significantly better. So it's a benefit for most people, but again, unless you have a problem with your cataract, unless you say I'm not happy with my vision, we don't recommend surgery.
All right. Dr. J. Rex Parent, always a pleasure to have you on the show. Thank you so much, and we hope to see you really soon, okay?
Thank you.
And Susie Pally, congratulations on your new vision in life.
Indeed, thank you.
And the best of luck, of course, and I know you'll be just fine for your second surgery. So, and thank you for being here and being a testimonial. All right. Well, we're going to take care of Amos and Sarah off the air right after the show, but next Tuesday night at 7:30, Steps for Delivering a Healthy Baby with Dr. John Drake. I'm Mark Evans, and we'll see you next week. In the meantime, take care of yourself. Thank you for the calls tonight, and thank you for watching and supporting PBS 39. Good night.
The preceding program on PBS 39 was made possible in part by
The Eye Center of Fort Wayne is devoted to eye care. Dr. Rex Parent, along with medical optometrists James French, Paul Gill, and Gregory Zink, specialize in medical and surgical eye care. For refractive treatment, the Eye Center of Fort Wayne utilizes technology such as Bausch & Lomb custom LASIK and multifocal refractive lens exchange. More information is available at 424-5656 or drparent.com.